Hi everyone, welcome back to my YouTube channel. Today I'm going to discuss some things about PESCI exams or pre-employment structured clinical interview exam, which is a test done for the international medical graduates who planning to join the workforce here in Australia as GPs, so internationally qualified general practitioners who want to come and work here as GPs. They have to go through this PESCI process. So I'm going to discuss a bit more details about the PESCI process. First of all, this pre-employment clinical structured interview is a requirement by AMC, Australian Medical Council need you guys to do this. And once you completed this successfully, like if you pass your PESCI, that PESCI provider will give a recommendation to APRA or the Medical Board of Australia to say that the doctor who has applied for this PESCI exam or PESCI process has fulfilled the requirement to be eligible to registered as a doctor to work here. So it's kind of giving a bit of recommendation to the medical board. That's the prime aim of this PESCI, but that's a requirement by the Australian Medical Council to make sure that you guys are sort of transformed enough to do work as a GP in Australia. So that's why international medical graduates need to get through PESCI to be eligible to work as a GP here. As I just mentioned here, just a while ago, there are PESCI exam providers. There's actually 3 in Australia now. Main PESCI provider or the college or the body that gives you PESCI is RACGP, Royal Australian College of General Practitioners. They are registered or accredited PESCI provider for Australian Medical Council and Medical Board. The other 2 are ACRAN, that's the rural and remote medical, ACRAN is Australian Rural and Remote Medical College. So they also can act as a PESCI provider. The third one is it's very recently joined the PESCI provider group. They call IME. I think Institute of Medical Education is their name. IME Medical, or Institute of Medical Education. Yes, they are the third college or the group that it's not a college, but it's a group that provide or a provider that provide the PESCI exam for the international medical graduates. Out of these 3, from my memory, I think that's correct. RACGP is only giving face-to-face PESCI, like you have to present in person to do the PESCI. But the other 2, ACRAM and the IME, you can do online PESCI like via Zoom, like, remote PESCI exam. So I think this would be useful for you. Like if you select IME or ACRAN as the PESCI provider, you could do the exam on remote mode or through the like via Zoom link. The other thing about PESCI is like you will have to pay a fee. It's roughly around like it's range. It's a range with these different providers, but it's roughly around $2,100 to $2,500. From my memory, I think RSCGP is charging you 2,100 and something, and IME is almost 2,500. Akram free, I'm not sure, but I will put you some links to link under this video, so that you can find the fees and things in detail. First of all, those are covering some ideas about where you can go to get a PESCI done. So you could go to either RSCGP or ACRAN or to IME Medical, those three places. You can Google search them, and then you can find details about them, and then you can register to apply for PESCI. But there are some requirements, like required things for you to be eligible to become a person to do PESCI. I will probably take you to one of the sites, maybe RSCGP, then you will find it. Yeah, so let's go to the RSCGP website. So here, the pre-employment structured clinical interview, PESCI. This is RSCGP website from my computer. And as I discussed before, it is to the IMGs, or international medical graduates, who wanted to get limited registration or provisional registration. I think I mentioned this before somewhere. Limited registration is you register with APRA with AMC Part 1 only, then it's a limited registration. If you got through your AMC Part 2 as well, then you're eligible for provisional registration. So you need to do a PESCI to be eligible to register in either categories through APRA. For you to get the PESCI, you need to go to these different colleges, RSCGP, ACRAN, or IME. So what is PESCI then? PESCI is checking your basic skills to be a GP, you should be able to get a comprehensive history, good clinical examination, interpretation of investigations, and then clinical judgment, then your professionalism, your communication skills, and those areas you should be able to cover. Those will be tested in a PESCI exam. Okay, like here, the RSCGP is mentioning that whether you have the clinical knowledge, skills, and experience to practice safely and effectively in the position as a GP. One thing I have to mention is PESCI is specific for one place, which is if you apply for a GP position in, say, Ballarat of Victoria, for instance, that PESCI exam is just directed to that Ballarat clinic and then their population. If you go through a PESCI in Ballarat, you can't go and work in Tasmania, for instance. So you have to remember it's directed at one specific location. So it's location specific. So how is PESCI conducted? PESCI is like a structured clinical interview. And then that's conducted by panel of 3 interviewers in RSCGP format. Others would be the same, I think at least 2 or 3 interviewers. And then out of those 3, there's 2 medical practitioners, ideally 2 GPs. And then the interview would go probably for a 60 to 90 minutes time. In that time, they will give you a few clinical scenarios, probably about 4 clinical scenarios. And during these scenarios, they'll be checking your clinical knowledge, clinical reasoning, and management skills, and whether you practice culturally appropriately. For instance, if you get a PESCI case about an Aboriginal patient, you should be sort of culturally sensitive to their culture. Or if you're consulting a patient, if your PESCI scenario is about a member of a community who recently migrated to Australia, say a refugee or an international different nationality person of a different nationality who migrated to Australia recently. They call CLAD or something, CLAD. And so if are you aware about their religious and cultural sort of beliefs and things, that would be tested in a PESCI scenario. So you should be practicing culturally appropriate medicine. So that they will be test you on during a PESCI scenario. So as I said here, the RSEGP is talking about that. During each scenario, the panelists will explore how you apply your clinical knowledge, reasoning and management skills, as well as culturally appropriateness, communication and professionalism. Those are the domains they will be testing you on, like key domains, right? Your clinical knowledge, clinical reasoning, your management skills, whether you practice culturally appropriate medicine, whether your communication skills are up to the standard of a GP, and do you act as do you show professionalism in your approach to your clinical cases. So they may consider your experience, and they may consider the location of the practice. That's why I said to you before, if you do a PESCI in Ballarat, targeting a clinic in Ballarat, you can't use the same PESCI results to go and work elsewhere, because it's location specific, and then it's also thinking about the level of supervision they offer from the clinic. For you to be eligible for PESCI, you should have, let's see, eligibility check. You should have your AMC Part 1. And then you should, you can check it from the APRA website. So you were taken to the APRA website to find the eligibility check here. Yeah, here. So they say you should have English test, and then you should have your AMC Part 1, and then you should, of course, have an offer from a clinic where they can offer you a supervised practice with a supervisory plan. Okay, we'll go back. So then you apply for the PESCI, and then you schedule the PESCI, and then you face the interview. So these are the requirements here. You should have a CV in the RSEGP format or APRA format, and then you should also have AMC MCQ exam. Clinical exam is not a must, but if you have clinical exam, you should be eligible to register as a provisional registration. But if your AMC Part 1 is enough, then you will be eligible to limited registration. Those are different registrations types only. And then position description from the clinic. And then you should have APRA Supervised Practice Plan or SPPA 30. Then you pay the fees. Like as I said here, RSEGP is 2,145. But as I said, IME maybe about 2,400 or something, roughly. But I'll put links under here. If I summarize again, PESCI is like a objective structured clinical interview, which is a pre-employment clinical interview conducted by these three different bodies, RSEGP, ACRAM, and IME. All three are accredited PESCI providers to AMC and APRA. Once you register with them, and once you get through the PESCI, you should be eligible to register as a limited registration with APRA or provisional registration with APRA, depending on whether you have AMC 1 or 1 and 2 both. Then you should have a supervisory plan, AMC Part 1, and English, OET or IELTS. then you should be good to go to work as a GP. I think this is in a nutshell things that you should know about PESCI. Okay, if you have any questions, just forward them under the video here. I'll try to answer your questions then and there. Okay, have a good one. See ya.